Ever get that, like, I don't know, kind of nagging feeling, like something's just a little off?
Yeah.
Maybe it's like just a bit of indigestion, or, you just need a good night's sleep. But what if it's something more? Something you haven't even, like, considered. Today, we're diving deep on a topic that, well, quite literally keeps us alive. Heart health.
Yeah, heart health.
We're not talking about, like, the generic advice you see, everywhere.
Right.
This is about understanding your heart's unique, I guess, needs and equipping you with the knowledge to make informed decisions about it.
Absolutely.
We'll be separating fact from fiction, unpacking some of those common misconceptions we all hear, and exploring some cutting-edge advancements, the things that are really changing the game for heart health.
It's fascinating to me how often we just take our hearts for granted. I mean, it's this incredibly powerful organ working tirelessly every single day, and yet we often only start to think about it when something goes wrong.
Yeah, you're right.
This deep dive is all about shifting that perspective, giving you the tools to be proactive about your heart health, not reactive.
I like that, being proactive, not reactive.
Oh.
So to help guide us today, we've got two incredible sources.
Okay, what are they?
A YouTube video featuring a cardiologist who breaks down the often confusing world of heart attacks and cardiac arrest.
Okay.
And we've got an ebook that's like basically a comprehensive owner's manual for your heart.
Sounds thorough.
Yeah.
So what's the mission of this deep dive?
Well, to equip you with the knowledge to recognize those potential problems, understand the often subtle warning signs that our bodies give us, and discover those actionable steps that you can take, like right now, to keep your heart running strong for the long haul.
I'm in. Let's do it.
So let's start by addressing, well, the elephant in the room, or I guess in this case, the muscle in our chests.
The heart?
Yeah, the heart. The difference between a heart attack and a cardiac arrest. These terms, they get thrown around a lot, but they're not interchangeable.
No, not at all.
So how can we make sense of the difference?
Well, the YouTube video actually uses a really brilliant analogy to illustrate this point. Imagine your heart is, well, a house.
Okay, a house, I like it.
A heart attack is like a plumbing problem, like a clogged pipe that slows down or even completely stops blood flow to a section of the house.
Interesting.
In this case, the clog, it's usually a blood clot that forms in an artery that's, already narrowed by plaque buildup.
Oh, so it's not just a sudden thing.
Right. It's often a gradual process. And that section of the heart, deprived of oxygen-rich blood, it starts to suffer damage. How severe that damage is, well, it really depends on how long that blockage persists.
So kind of like a plant wilting without water.
Exactly. And just like you'd call a plumber ASAP for a burst pipe, time is of the essence when it comes to treating a heart attack.
So acting quickly is key.
Absolutely.
Now, what about cardiac arrest? How does that fit into our house analogy?
Well, cardiac arrest is like a sudden power outage in that house. The lights go out, everything shuts down, the heart's electrical system, the one responsible for those rhythmic beats we all rely on, it malfunctions. The pumping action just stops.
So it's not just a slowdown, it's a complete shutdown.
Exactly. And that's where understanding the difference between heart attack and cardiac arrest, well, it's literally a matter of life and death. Because cardiac arrest requires immediate intervention.
Like what?
CPR and defibrillation, to try and restart that electrical system.
The ebook also points out that a heart attack, if it's severe enough, can actually trigger cardiac arrest. So that damaged heart muscle can disrupt the electrical signals, leading to a full system failure.
It's a scary thought, which is why recognizing the warning signs of a heart attack and seeking immediate medical attention is so crucial. It's all about preventing that cascade of events that can lead to cardiac arrest.
Right, so let's talk warning signs. I think we all know the classic symptoms of a heart attack, that crushing chest pain radiating down the arm. But the ebook highlights how it's not always so clear-cut, especially for women.
Yeah, that's important to remember. Women often experience heart attacks differently. Instead of that classic chest pain, they might have jaw pain or maybe discomfort only in the arm, unexplained fatigue, or even just a sense that something's not right.
So basically, we shouldn't just dismiss those subtle or unusual symptoms.
Absolutely not. The ebook really stresses that any sudden or persistent discomfort, especially if you have, other risk factors for heart disease, should be checked out by a doctor. Don't try to convince yourself it's just indigestion.
Right, get it checked out.
Let a professional give you the reassurance.
I think a lot of us, and myself included, we tend to downplay those little aches and pains. We're just so used to pushing through discomfort. But when it comes to our hearts, it really does sound like erring on the side of caution is the best approach.
It is. Remember, time is muscle when it comes to a heart attack. The faster you get treatment, the less damage to your heart.
Makes sense. The ebook also debunks a common myth that I think could be costing people precious time.
What's that?
That you just know if you had high blood pressure or high cholesterol.
Yeah. You might not feel those conditions, even if they're present. That's why regular checkups are so crucial.
Yeah, regardless of how healthy you feel.
Exactly. It's about catching those issues before they have a chance to cause any damage.
It makes sense. We tend to focus so much on how we feel, but sometimes those internal warning signs are really subtle or even non-existent.
Right.
Regular checkups, it's kind of like peeking under the hood of your car, making sure everything's running smoothly.
Well, that's a great analogy. And just like regular car maintenance can prevent major breakdowns down the road, those checkups can help identify and address potential heart problems before they become emergencies.
We talked about how treating a heart attack swiftly can help minimize the damage. But what happens once you actually get to the hospital? What can someone expect?
Well, the main goal of heart attack treatment is to restore blood flow to that blocked artery as quickly as possible. The cardiologist in the YouTube video, he explained that they strive for what's called door-to-balloon time.
Door-to-balloon time.
Yeah. It refers to the time it takes from when a patient arrives at the hospital to when they can open up that blockage using a balloon catheter. Ideally, it's under 90 minutes.
So for someone experiencing a heart attack, what does that mean for them? Why is that 90-minute window so important?
Well, imagine that blocked artery is like a traffic jam on a major highway. The longer the jam persists, the more backed up traffic gets, and the longer it takes for things to flow smoothly again.
Yeah, I can see that.
In the case of a heart attack, that traffic jam is preventing oxygen-rich blood from reaching a section of your heart muscle. Every minute that blockage remains, more and more heart muscle is starved of oxygen and starts to die. That's why getting that artery open quickly is so important.
To minimize the damage, right?
Exactly. It's about minimizing the damage and preserving as much heart function as possible.
And this balloon catheter procedure, what does it actually entail?
It's actually a minimally invasive procedure. The cardiologist inserts a thin, flexible tube, called a catheter, into an artery, usually in the groin or wrist. This catheter is then carefully threaded up through the circulatory system, guided by X-ray imaging, until it reaches the site of the blockage in the coronary artery.
Oh.
Once it's in position, a tiny balloon at the tip of the catheter is inflated, compressing the plaque against the artery wall, and that's what restores the blood flow.
That's pretty incredible. It's like a tiny plumber going in and clearing that blockage. And I think in some cases they also insert a stent to help keep that artery open, right?
Exactly. A stent is a small, expandable metal mesh tube that acts like scaffolding. It provides support to the artery wall and prevents it from collapsing. In many cases, the stent remains in place permanently, ensuring long-term blood flow.
That's fascinating. You know, we've talked about how heart disease can kind of sneak up on you, especially with those silent conditions like high blood pressure and cholesterol. Someone listening might be thinking, well, I'm young and healthy. Heart disease is something I'll worry about later. But the ebook really challenges that misconception.
It does. The truth is, the foundation for those heart problems, well, it can be laid down much earlier in life than most people realize. The buildup of plaque in our arteries, that atherosclerosis we talked about earlier, it can actually begin in childhood and adolescence.
So those unhealthy habits we pick up young, like, the fast food, the lack of exercise, they really do have long-term consequences.
They absolutely do. It's like neglecting regular oil changes for your car. You might not notice any problems at first, but over time, that neglect leads to wear and tear, decreased performance, and eventually major engine trouble.
So our hearts are no different.
No, they're not. The choices we make today, they have a cumulative effect on our cardiovascular health over time.
So it's never too early to start taking care of our hearts.
Exactly. And the good news is, even if you have a family history of heart disease, you're not doomed. By adopting a heart-healthy lifestyle, you can significantly reduce your risk.
That's really empowering to know. So let's talk about those lifestyle changes. What are some concrete steps people can take to start showing their hearts some love?
Well, if you're a smoker, quitting is the single most important gift you can give your heart. The ebook goes into a lot of detail about the devastating impact of smoking on our cardiovascular systems. It damages blood vessels, raises blood pressure, increases clotting, and promotes inflammation.
Wow, that's quite a list. I think most people associate smoking with lung cancer, but it sounds like it's equally detrimental to our hearts.
It is. Smoking increases your risk for a whole host of cardiovascular problems. You're talking heart attack, stroke, peripheral artery disease, aortic aneurysm. You're even at a higher risk for sudden cardiac death.
That's a pretty compelling case for quitting. But for someone who's been smoking for years, is it really possible to reverse that damage?
Well, the good news is quitting brings almost immediate benefits. Your blood pressure and heart rate drop within minutes of your last cigarette. Over time, your circulation improves, your lung function increases, and your risk of heart disease drops significantly.
It's amazing how resilient our bodies are.
It really is.
They really want to heal themselves.
And even if you've been smoking for years, quitting can dramatically reduce your risk of heart disease. Within a year, your risk of coronary heart disease is cut in half, and after 15 years, it's nearly the same as someone who's never smoked.
So it's never too late to quit. That's definitely encouraging. What about diet? What are some key things people can do to kind of, fuel their hearts properly?
Think of it this way. Your heart is a high-performance engine. You wouldn't put cheap, low-grade fuel in a Ferrari, would you? Your heart deserves premium fuel, too.
So ditch the processed junk.
Exactly. The ebook breaks down a heart-healthy diet into simple, actionable steps. It's all about focusing on whole, unprocessed foods. Fruits, vegetables, whole grains, lean protein sources, and healthy fats.
So fill your plate with colorful, nutrient-rich foods.
Exactly. The ebook specifically recommends the Mediterranean diet as a great model.
And why is that?
Well, what makes the Mediterranean diet so beneficial is its emphasis on fresh, whole foods, particularly fruits, vegetables, legumes, and whole grains. These foods are packed with antioxidants, fiber, and essential nutrients that support heart health.
I see.
The diet also features healthy fats like olive oil and avocados, which have been shown to improve cholesterol levels and reduce inflammation.
The thing is, it's not about deprivation, right?
Right.
It's about enjoying flavorful, satisfying meals.
And that's a key point. It's about finding a way of eating that's both enjoyable and sustainable.
Yeah, because deprivation diets rarely work in the long run.
Exactly.
What about portion control? Does it really matter if you're eating all the healthy foods if you're overeating?
Yeah, portion control is definitely a key part of a heart-healthy lifestyle. Even healthy foods can contribute to weight gain if you eat too much of them. The ebook suggests using smaller plates, being mindful of your hunger cues, and savoring your food rather than rushing through meals.
I like those tips. It's easy to get caught up in that clean eating trend and think as long as the food is healthy, you can eat as much as you want.
Yeah.
But portion control is still essential.
It is. It's all about finding that balance and listening to your body's cues.
Okay, so we've talked about quitting smoking, eating a heart-healthy diet, and managing portion control. What about exercise? How does physical activity impact our hearts?
Well, your heart is a muscle. And like any muscle, it needs to be worked to stay strong and healthy. Regular exercise has a multitude of benefits for our cardiovascular system.
So you're saying it's not just about weight loss or looking good, it's about overall health.
Absolutely. Regular physical activity helps lower blood pressure, improves cholesterol levels, helps maintain a healthy weight, reduces inflammation, and it can even improve blood sugar control. It's a win-win for your heart and your overall health.
So what kind of exercise are we talking about? Do you have to hit the gym every day?
Not necessarily. The key is to find activities you enjoy and can stick with. The ebook recommends aiming for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week.
So that could be anything from brisk walking to swimming to dancing, really.
Exactly. Find something you enjoy, make it a part of your routine, and you'll reap the rewards. And remember, listen to your body. Start slowly and gradually increase the intensity and duration of your workouts over time.
It's not about pushing yourself to the limit every time you exercise.
Right. It's about finding a sustainable routine that you can maintain over the long term.
Okay, so we've covered quitting smoking, eating a healthy diet, portion control, and exercise. What else can people do to show their hearts some love?
Well, one often overlooked but crucial aspect of heart health is stress management. We tend to think of stress as this purely mental or emotional experience, but it has a very real impact on our physical health, particularly our hearts.
We've all heard the phrase, stress can break your heart. But is there any truth to that?
Absolutely. When we experience stress, our bodies release a cascade of hormones.
Like what?
Like cortisol and adrenaline. These trigger a fight or flight response. Our heart rate and blood pressure increase, our breathing becomes shallow, and our muscles tense up. It's a natural and helpful response in short bursts, but when this stress response is chronically activated, it can really wreak havoc on our cardiovascular system.
It's like our bodies are constantly on high alert.
Exactly. And over time, this chronic stress can lead to chronic inflammation, elevated blood pressure, and even changes in our blood clotting ability, all of which increase our risk for heart problems.
That makes sense. So what can we do to manage stress, protect our hearts?
The ebook suggests a variety of evidence-based techniques, including mindfulness meditation, deep breathing exercises, yoga, spending time in nature, and even just connecting with supportive friends and family members.
It's not just about finding ways to relax then. It's about cultivating meaningful connections and building that support system.
Exactly. Human connection is a really powerful antidote to stress. Feeling loved and supported can actually buffer us against the negative effects of stress on our hearts.
It's a good reminder that taking care of our hearts is not just about what we do on our own, but also about the people we surround ourselves with.
Exactly. And it's not just about having people to lean on when things get tough. It's also about cultivating a sense of community and belonging. That feeling of being connected to something larger than ourselves can be incredibly powerful for our heart health.
So we've covered a lot of ground in this part. We've talked about those key lifestyle changes: quitting smoking, eating a heart-healthy diet, managing portion control, getting regular exercise, and finding healthy ways to manage stress.
It's a lot to take in.
It is, but it's important. These are incredibly powerful steps that anyone can take to improve their heart health and their overall well-being.
And remember, it's not about being perfect. It's about making small, sustainable changes that you can stick with over time. Your heart is worth it.
Welcome back to our deep dive into heart health. In part one, we kind of laid the groundwork, exploring the differences between heart attack and cardiac arrest and, debunking those sneaky myths that can lead us astray. We also dove into those everyday choices, that really impact our heart health.
Yeah, we talked about how even seemingly small changes, like swapping out those processed snacks for a handful of nuts or taking a brisk walk during your lunch break, those can add up to big wins for your heart in the long run.
Absolutely. And we emphasize that it's never too early to, really start prioritizing heart health.
Yeah.
Those choices we make, even in our younger years, well, they have a ripple effect. They can influence our cardiovascular well-being for decades to come. But what happens when, despite our best efforts, things go wrong? What if you start experiencing some of those warning signs, the ones we talked about earlier?
Yeah, that's where knowing what to do in a cardiac emergency, it can literally mean the difference between life and death. So let's dive into those crucial first steps.
Yeah, let's. It can be hard to stay calm when you're feeling those symptoms, but it sounds like recognizing them early and taking swift action is key. So what's the first thing someone should do if they think, they might be having a heart attack?
Call 911 immediately. Don't wait to see if the symptoms subside. Don't try to drive yourself to the hospital. Every minute counts when it comes to restoring blood flow to that heart muscle.
Yeah, it can be tempting to, maybe downplay those symptoms. Try to convince yourself it's something less serious. But it sounds like it's always better to, err on the side of caution.
I agree. Calling an ambulance ensures that you receive the fastest possible care. The paramedics, they can begin treatment on the way to the hospital and, alert the hospital so that they're prepared for your arrival.
The cardiologist in the YouTube video explained that the ambulance crew can often do an EKG, on the way to the hospital. And this can alert the hospital to prepare for immediate intervention. Is that pretty common practice these days?
Yeah, it's becoming increasingly common, and for good reason. That early EKG can provide valuable information about, what's happening with your heart. And that helps the medical team determine the best course of action.
So while you're waiting for the ambulance, is there anything you should or shouldn't do?
Yeah, the most important thing is to stay calm. Rest. If you can, try to loosen any tight clothing and take slow, deep breaths.
The ebook also mentions chewing an aspirin. Is there a particular reason for that?
Well, aspirin acts as a blood thinner, and that can be really helpful in a heart attack situation. If you happen to have aspirin on hand and you're not allergic to it, chewing a regular strength aspirin, while you're waiting for the ambulance, it can potentially help limit the damage.
Okay, good to know. It's amazing how just a simple over-the-counter medication can play such a, vital role in a cardiac emergency.
Yeah.
Now let's talk about what happens once you get to the hospital. What kind of treatment can someone expect for a heart attack?
The primary goal, really, of heart attack treatment is to restore blood flow to that blocked artery as quickly as possible. We talked about the door-to-balloon time earlier, that 90-minute window. The goal is to open the blockage using a balloon catheter.
It sounds like the medical team is really working against the clock in those situations.
They really are, and for good reason.
Yeah.
The longer that artery remains blocked, well, the more damage there is to the heart muscle.
A lot of people, I think, picture open heart surgery when they think of heart attack treatment. But this balloon catheter procedure sounds much less invasive.
It is.
Can you walk us through how it actually works?
Sure. So the cardiologist inserts a thin, flexible tube called a catheter into an artery, usually in the groin or the wrist. This catheter, it's carefully guided through the circulatory system using X-ray imaging until it reaches the site of the blockage, in that coronary artery.
Wow, that's amazing. It's like threading a needle through like this maze of blood vessels.
It's a great way to put it. It requires a lot of skill and precision. So once the catheter is in position, a tiny balloon at the tip is inflated, compressing the plaque against the artery wall, and that's what restores the blood flow. In many cases, they'll also insert a stent, that little metal mesh tube we talked about earlier, and that helps keep the artery open and prevents it from reclosing.
Now, what about any potential downsides or risks associated with these newer stents? Are there any trade-offs that people should be aware of?
That's a great question. While stents are generally safe and effective, there are some potential risks, like bleeding, infection, or an allergic reaction to the stent material. There's also a small risk of the artery reclosing over time, a condition known as restenosis.
So it's not a foolproof solution then?
Right. No medical procedure is completely without risk. But, stents have really significantly improved outcomes for heart attack patients. And they continue to evolve with new technologies and materials that minimize those risks.
Okay, so we've covered what to do if you suspect a heart attack, the importance of calling 911 immediately, and the typical treatment you can expect at the hospital. But what about cardiac arrest? How does that differ in terms of emergency response?
Well, with cardiac arrest, there's really no time to wait for an ambulance. Immediate CPR and defibrillation are crucial for survival.
Right. CPR, that's cardiopulmonary resuscitation, right?
Yeah.
The chest compressions and rescue breaths we've all, seen on TV.
Exactly. So CPR, it helps to circulate blood and oxygen to the brain and other vital organs, while defibrillation, that electric shock delivered by an AED, attempts to, reset the heart's electrical rhythm.
It sounds, intense, but also incredibly empowering. Just knowing those basic CPR techniques could literally save someone's life.
Absolutely. And thankfully, those AEDs, the automated external defibrillators, they're becoming a lot more common in public places. And that makes it easier for, bystanders to intervene in a cardiac emergency.
Yeah, I remember seeing a news story a while back. It was about a local high school student who saved a teacher's life using an AED. It's amazing how, these devices are making it possible for everyday people to step up and really become heroes.
It is. It's a testament to the power of, knowledge and preparedness. These AEDs, they're designed to be used by anyone, even without, specific medical training. They literally talk you through the steps and guide you through the process of delivering that life-saving shock.
So everyone should, sign up for a CPR class. Where can people find those trainings?
Well, organizations like the American Heart Association and the American Red Cross, they offer CPR and AED training courses all over the country. You can, check their websites or even ask your local fire department or community center.
It's just a valuable skill that I think, everyone should have. You never know when you might be called upon to use it.
Absolutely. And while knowing those emergency procedures is crucial, the ebook also reminds us that, true heart health goes beyond just those physical interventions. It's about cultivating a more holistic sense of well-being. That means our physical, mental, and emotional health.
Yeah. So it's not just about what we eat and how much we exercise. It's also about how we manage stress, how much sleep we get. Even the quality of our relationships, right?
That's right. All of these factors can play a role in our cardiovascular well-being. We tend to compartmentalize our health, but in reality, it's all interconnected.
We talked about stress earlier and how, chronic stress can wreak havoc on our hearts. But a lot of people struggle to manage stress effectively. It's easy to say, just relax, but it's not always that simple.
No, it's not. You're right. Stress management is a skill. And it takes practice and patience, but it's a worthwhile investment, especially when it comes to protecting our hearts. The ebook goes beyond, just suggesting meditation and yoga. It emphasizes finding activities that bring you joy, help you feel grounded and connected.
So it's not about forcing ourselves to relax. It's about finding those activities that truly, I guess, nourish our souls.
I like that. Nourish our souls, exactly. That could be anything from, spending time in nature, listening to music, maybe pursuing a creative hobby, or simply spending quality time with loved ones.
It's almost like we often think of self-care as a luxury, but it really sounds like it's a necessity for good heart health.
It really is. And it's not selfish at all to, prioritize those activities that bring you joy and replenish your energy. In fact, it's one of the most loving things you can do for yourself and your heart.
I love that perspective. And speaking of love, we touched earlier on the power of social connection and how it can, kind of buffer us against stress. What else does the research say about the link between, our relationships and our heart health?
Well, studies have shown that people with strong social connections tend to have lower blood pressure, better heart rate variability, and even stronger immune systems. It's like having, this built-in stress resilience.
So just having close friends and family can actually protect our hearts.
It really seems so. And it makes sense, right? I mean, when we feel loved and supported, we're less likely to experience that chronic stress and more likely to engage in, those healthy behaviors. We've got people to cheer us on, hold us accountable, and just, be there to help us through those challenging times.
Yeah, it's a nice reminder that, we're not meant to go through life alone. We need those connections, those bonds that make us feel, seen, heard, and valued. And it sounds like those connections aren't just good for our souls, but for our hearts as well.
It's all part of that holistic approach to well-being that we've been talking about. Taking care of our hearts. It's not just a solo mission. It's a journey that we can take together.
Welcome back to the Deep Dive. In the last couple of parts, we really covered a lot. We talked about the difference between heart attack and cardiac arrest, busted some of those common myths that we hear, and even explored some of those powerful everyday choices that can really impact our heart health.
Yeah, we even touched on that, often overlooked connection between our mental and emotional well-being and our physical health.
Right, like how managing stress, being positive, and even just nurturing those meaningful connections in our lives, well, those things aren't just for, feeling good. They're actually essential parts of a heart-healthy lifestyle. It's been a pretty insightful journey so far, but, as we start wrapping up our deep dive into the world of heart health, let's, maybe turn our attention to the future for a bit. What's on the horizon when it comes to heart disease, like prevention and treatment?
Well, the ebook actually highlights some really cool advancements, particularly in the field of personalized medicine. It's about moving away from that one-size-fits-all approach to healthcare and really tailoring treatments and prevention strategies to each person's unique genetic makeup and risk factors.
So it's like, custom tailoring a healthcare plan just for your heart.
Exactly. Imagine a future where your doctor can analyze your genes and actually pinpoint your specific predispositions for heart disease. That would allow them to recommend the most effective preventative measures just for you.
Okay, that sounds kind of like something out of a science fiction movie, but it's becoming a reality.
It really is. Researchers are making huge strides in, unraveling that complex interplay of genes, lifestyle, and environmental factors that can contribute to heart disease. And this personalized approach really allows for more targeted interventions, which, of course, increases the chances of success.
So it's not just about our family history anymore. We can actually take control of our genetic predispositions, you're saying?
Well, family history is still a big part of it, but it's not the whole story. This personalized approach takes into account, a much wider range of factors, which gives us more tools to really proactively manage our heart health.
That's amazing. It really shifts the focus, from reacting to problems to actually trying to prevent them in the first place. What about when it comes to treatments? Are there any new developments that are changing the game for those who, already have heart problems?
Yeah, one area that's showing a ton of promise is regenerative medicine, specifically the use of stem cells to, help repair damaged heart tissue.
I've heard about that, but it still seems so futuristic to me. Can you explain how it actually works?
It's definitely cutting edge. So stem cells, they're basically these blank slate cells, and they have this amazing ability to transform into different types of cells in the body. Scientists are exploring ways to use these stem cells to actually regenerate healthy heart cells after a heart attack.
Wow. So you're saying, there's hope that one day we might be able to reverse the damage from a heart attack.
That's the goal. And stem cell therapy is still in its early stages, but Clinical trials are yielding some really encouraging results. Scientists are, exploring different ways to deliver those stem cells to the heart and stimulate the growth of that new tissue.
That's incredible. It's amazing to think we might be able to regenerate our own hearts one day. Are there any other, I guess, advancements on the treatment side that are helping those with heart problems to live a better quality of life?
Absolutely. Advancements in medical technology have actually led to this whole range of new devices and procedures that are helping heart patients live longer, healthier, and, more fulfilling lives.
Like what? What are some examples?
But we talked about those stents earlier that are used to, prop open those blocked arteries. Well, the newer generation of stents are even more sophisticated. Some of them slowly release medication over time, and that helps prevent reblockage. And others are actually bioabsorbable.
Bioabsorbable, what does that mean?
It means they actually dissolve over time, leaving the artery totally free and clear.
It's incredible how technology is always evolving to improve those treatments. What about for people with heart failure? Are there any, new treatments giving them hope?
Heart failure is a serious condition, but thankfully there are new medications and devices that are helping patients manage those symptoms and, live longer and more active lives.
What are some of those advancements?
Well, there are now these implantable devices that constantly monitor the pressure in your heart, and they'll, alert your doctor if there's a problem. And this early warning system allows for, really timely interventions, and that can help prevent those potential complications.
So it's almost like having this 24/7 guardian angel for your heart.
Exactly. And for patients with, really severe heart failure, those who aren't eligible for a heart transplant, well, there are artificial hearts. These are also known as left ventricular assist devices. They're implantable, and they literally help to pump blood throughout the body. They basically take over for that weakened heart muscle.
That's amazing how technology is stepping in to support those with those compromised hearts.
It really is. But while all these advanced treatments are incredible, it's really important to remember that the very best approach is always prevention. Those lifestyle changes we discussed in the earlier parts, well, those remain the foundation of a healthy heart.
So it's all about taking that proactive approach to heart health. Embracing a heart-healthy lifestyle, staying informed about the latest, advancements, and just working closely with your healthcare providers.
Exactly. It's about empowering yourself with knowledge and, really taking an active role in your heart health journey.
Well, that wraps up our deep dive into heart health. We've covered a lot of ground here, from how our hearts work to, those cutting-edge advancements that are changing the future of heart care.
We learned about the difference between a heart attack and a cardiac arrest, busted some common myths, and even explored those simple but powerful lifestyle changes. And we even got a glimpse into what the future of heart health might look like.
But the most important takeaway from all of this is your heart health is in your hands. By making those informed choices, adopting that heart-healthy lifestyle, and staying, engaged with your healthcare, you can really give your heart the love and care that it deserves.
And be sure to subscribe to The Deep Dive for more in-depth explorations of the topics that matter most to you. We're here to guide you, inform you, and empower you on your journey to a healthier, happier, and more fulfilling